Okay, you're live.
Hey guys, it's Dr. Emer. I have a patient here today who we're doing some subcision for. He's gonna feel this a little bit at the beginning, but once I get the cannula in, we put a little numbing medicine in, so feel that. And he has some acne scars that require us to put a little filler in them, but also some subcision. And by doing this, where we put the the numbing medicine in here at the same time, we can make it relatively comfortable for him and treat like a large area. Music.
It's outside, I think.
Oh, it's outside?
Mm-hmm.
So how does that feel actually? Are you really painful, or is it really painful, or are you okay?
I'm okay. It's just a little prick.
Like little pinches, yeah. So right now I'm focusing on releasing this whole little area here and putting numbing medicine in. And now he really shouldn't feel it so much. How does that feel? You okay?
Mm-hmm.
Okay, good. And so I'm literally going through all the areas that we circled and subcising that area. I'm going, kind of grabbing the skin and pulling those scars across. And this allows me to, all the areas that he sees, that he's focused on. A lot of these scars are a mixture, so he's going to have some. Do you have more local? He's going to have some here that are a little more ice pick, and you can see those over there. Those will require lasers and TCA cross. Hold on. Thank you. And the other ones for the surface that have a little bit of indentation will require filler, so we're going to use Bellafill at the same time. And then we'll laser. And the laser will give a good improvement. So we're releasing. I feel pretty much almost all these are released. How's that feel? You okay?
Mm-hmm.
Good.
Barely feel it.
Good. And that's great, because this technique myself and Devin Lim in Australia started doing not too long ago, and it really helps. It makes it way less traumatic for the tissue using a cannula to literally push through. Now with subcision, you sometimes get bruised and a little irritated. There we go. Good. You can see this is literally just grabbing the tissue and breaking apart the skin. It's like a fish underwater is what I tell people. You can see the skin moving like a little shark. There you go. Perfect. And then lastly, we have one spot back here that we'll just release a little bit. There we go. And sometimes you get bruised or swollen, but we know that that's what's going to happen. But it's very controlled, and there's much less bleeding with this cannula technique than using a no-core subcision needle. There we go. Okay, hold there. I got you. So I'm going to hold there. Now I'm going to take the filler. And we have pre-marked certain areas here that we're going to go under. Can you give me the light? We use a little light. Now he probably won't feel this much here. And we're going to go directly under some of these areas that we've lifted and just put a little bit of the Bellafill. Now Bellafill is a long-term filler. This has little beads you can see in here. It's a whitish particles inside, and in small quantities it's extremely safe. I use this all the time, even for wrinkles. But for scars, it's the only FDA approved one, and you literally can go right under the scars and just put small aliquots, and it will become part of the tissue and rebuild this underneath of some of these scars. We were one of the first sites to do clinical trials combining this with a microneedling device, which has now been published. Now I probably can do a couple scars on the other side. Good. So here's what I want him to do. Hold with your right hand, just a little bit of pressure. Turn your head all the way left, or to the right. There you go. And I'm just gonna do a few of the scars over here, shine over here. I know he numbed a while back, but I'm gonna do a few of them just because I have a little extra. We're gonna go right under those. You see how you can see those scars? We just go right under the surface and give a little bit, and they plump up immediately, but long term, you don't wanna overfill them because they build over time. Almost done.
Do you need to do subcision?
No, not on these actually. I think this is okay. I can go over there anyways and do it right after. Either way, it's not gonna. Yeah, like you can see here, this one, and this one we should subcise, anyways, and I'll do this a little bit.
There's one by the ear, if you noticed.
Over here?
Do you see it?
Yeah, we can get that too. Hold on. Perfect. Okay, so now let's go on this side. Grab me the subcision. So most of this is actually a regular texture. However, interestingly, it improves even with the subcision. So what we're gonna do, and we put it in the really superficial component of a couple of those scars there. But now what we can do is just go through, hold on, this area. And again, we're just gonna go real superficial. You see, like I said, like a fish in water. Put a little bit of the numbing, just a little. And again, you see how it moves through a little bit easier than the other side. There you go. And this allows us to lift the tissue, move through the tissue, and break apart any adhesions. You see, look, it's just breaking apart those adhesions. You can see it pretty much right away. Look at this one spot by his ear. Now you can combine this with lasers or peels because this is under the surface, even when you're doing the fillers. Personally, I actually think that the Bellafill improves more with radio frequency treatments at the same time because it stimulates collagen. There we go. This one, I wanted to get this stupid one right here. It won't go. Now we got it. Good. Okay, there we go. Lifting all the scars. Okay. Hold here for her. Hold for, no, we got it. We got it. Now I'm gonna turn here. I'm just gonna do a little subcision on this one right here. Now by his ear, he also has a few scars, so we're just gonna do one insertion point right here, just a small one. I'm sorry for this little pinch. Grab a gauze, and then what we're gonna do, hold on, need a little gauze for his ear. Yeah, you don't wanna get water in there. Go right under the surface of that scar. You can see it. It's not wanting me to go under there. You see?
Mm-hmm.
There we go. You saw it, we broke right through. There we go. Scar is now broken. Good. Okay, hold right there. All right, so that's subcision with Bellafill, and now we'll do the next step in a little bit with the laser treatments. Good. You're probably gonna get a bruise.